Welcome to today's workshop.
Yeah, no, yeah, focus on Idiania Yedi, any Ehunsu Swanso. Yeah, a boy my to me their dietitians, they catch say, to me boy me to me this so.
I am Precious Adade Duodu, a senior lecturer in adult nursing, an international lead for nursing, and also a co-chair for Black Staff Affinity Group at the University of Huddersfield, UK. Then komodiene de nina jina aye esiche yare abrofo your friend diabetes ho eno na ye ba be ka ho asem aye nhwehwemu kakra be ye emfimienu aba be sinkonie na san hwehwemu ne ye no ye ma ye de adwene ko eduane die hu se na menu aba ma ne kan ye eno na ye de adwene si supporte brony be friend of Dietary Self-Care for persons living with type 2 diabetes inti eno na ye de adwene ko so pa.
You see, when you learn to eat your food as medicine, then you won't have to take your medicine as food. In terms of the choice, the timing, the quantities, and the source of food. So if obia yakasa or diabetes, otiminya sa knowledge ya na or implement fear the blood sugar, I don't think it will come from the diet, maybe stress.
Are you able to even follow the dietary plan at least 3 out of the 7 days? Enti nipakuwa yebisa omo no dodo ni na no it's 9.5 ohamu enchichemu no endu edumpo 9.5 ena omutimi edi ehyehyeye a yaka atro mo se omo ye no so na che se obedi eduane hyehyeye no den pa.
Can we factor mental health in NCD's education in our facilities? Because when it comes to nutrition, when you go to the various chronic centers or clinics, they have nutritionists there because they educate them whilst they are taking their medicine. But hardly will you see a mental health personnel in the NCDs or the DCOD. So how best can we factor them into this?
One of the key things, diet, very, very important. You can't manage diabetes without diet, because diet now will be and on part of your esichenu efriba into say one fa esichenu ngo mu a ehia say your body no ebe produce so much insulin to counter it.
Did you come across somebody linking diabetes with spirituality?
The import of all that we presented, especially about the mental health component, is that we are advocating for routine screening when it comes to mental health for people with diabetes in this case and chronic conditions or non-communicable diseases in general.
Apomudin for no ade a omo ye mama ni je ho ne se eto da bia omo de ye dro kra bre ufi.
Wow. Wow. Oh, yemo se ma apomudin aso for ye. Yeah.
Obia pese ochre wadura na pese odi edo no tumu a nka nipa no a oya edo na wato edo na ma wo no kwamane ntime nkyerɛ yare kro na wo kono ne farabai
health authorities no ns enye politics dia nka omo hwe se nke bia yen national health insurance scheme premium no ye be increase no na omatima ma ye quality drugs.
Uche Ghana ina ye beye eduasa opepe eduasa miansa na about 33 million na uche ma beye una uche mdunu ma baako nipekuo baako a ejina homa opepe mienu echiripon nan na omo no mo yare ne bi nti se be wa na obi a ye di kan ne se enye wonko a eye yare a nipa dodo pa obi.
Understanding whatever I am taking, the quantity, the timing, the calories. Inte aduane na makwa akoto no den ni den na ese woma media ebeboa me, not the taste nye de wo di ahun se me ho asepe me, but de woma eboa ni padua no
me ka say sister fu antie fu ka say ye mo modern say aduane be ye medicine and not say ye transform your medicine about be ye aduane. Into doctor's advice and then my own understanding of my welfare and my well-being into na ma fancy acquire any job. Na the Emma Abia yen sanye follow up no dear. Okasa for ska ho. Eno kre etoda ana ska sem ya na eden kakra.
In fact, some level of fasting helps improve wesichiri. But yes, we share patients based on their religious beliefs, which personally I respect. But senior mechanism about compromises and emanipano atia say it's good to pray. But whilst I will bomb payama yame a heal completely of the disease, you will die for wedro.
Our research has shown that people are more prone to depression, diabetes, distress, and we realized that about 27.1% of the people we spoke to were at risk of diabetes distress, right? And then about 37.8% of them were at risk of depression. So we are also suggesting, or as part of the recommendations, is to incorporate routine mental health screening as part of our diabetes care. Then so you who say into who say omo ka omo ho bom no a omo yare ni bi no omo ka omo ho abom no so mutimi hye omo ho nkran na bibia akotote itimi boa ema omo nso ehye omo ho nkran nti omo aduane die ekoye mpem bebre na ye obi a owo asupiti na oye adwuma hospital nkwana obetimi ama wo enchechre ebi a nipa na ono nso ye church na wonya suenhu no broni friend lived experience a wo hu say oh me di aduane we na boa me no otimi nso ene wo che ema ho so di bi etimi boa.
Ghana Health Service ye ni dietitians to do sa a omo ye facilities ye hospitals ni nyina enti your nutrition officers are omo fill a gap, and the plan is that you meet the person nipa no, and then one need in come to say the omu ye ya now find it out in riane a wodie any senior also betimi a modify no amano a suit no situation no eti ye linki omo, but there's a little gap, and the gap is that your dietitians and also when we take a juso as a municipal, we have only one dietitian who is in the municipal hospital, Ejuso. And in all the other centers, and I say all the other health centers and clinics, there are nutrition officers that cater for the needs of our clients there.
So if there is going to be a policy, so even you will be given that opportunity to be in the limelight to educate the public on nutritional needs, no, there should be a license, and I say you should be regulated.
Young ones now mo ban mama bemumu obi was yare we die no na dem beko wom enku fashion team say yare na nya nebeku obi atumi anya 97 years only a girls prefect e wo hono aden na wo so nhwo wo so yie e ma wo so nduru me de bia kwa me kasa mo kra mo betwam e wo ma be bia ma me na duru.
The Ghana Health Service has a policy. We have NCD policy, which was launched in 2020. I think I said it earlier on. And the policy highlights on health promotion and the risk factors of NCDs. So that's the main challenge. So when a client comes to the hospital, what is that? Is a client is referred to nutrition officers or dietitian based on the numbers that she or she gets, right? Yes, so the policy doesn't really talk about or doesn't really highlight that referral system or the flow of work. So that is the main challenge. So I think since we are having this forum, and from now on we can review, because I think it lacks so many things as in the policy. When you read about it, the detailing is not that much. So it's not that we don't have policy. We have policy, we have guidelines for NCDs that DM falls under or diabetes falls under, just that it's only focused on health promotion, which they do. Every facility in the morning, OPD, they do a health promotion. Yes, they do. So that is what the policy highlights.
Nipa baako na ye clinic ni nyina nipa ni gina ho o kyerɛkyerɛ omo sɛ nye waduane na ye tete so no na ehia omo na emum sei ni na eboa na even nipa na mpokwa obeka kyerɛ doctor sɛ doctor medwen sɛ medie die do ya manom ya ye nti medie hwi de omo beka nka ma mehwe menkɔ ho na menye den menkɔ try enhwe
nti da bia oba
ma call register, ma be checking me BP, ma checking me sugar, or kohu doctor, kohu dietitian, that cycle over and over for a very long time. They will get used to it and then get bored. Until I was saying introducing some interesting stuffs into the clinic. Previously, now I was part of a diabetic clinic team. So what we were doing was that at the end of every year, we organize a get-together. Get-together doesn't mean say come and eat and then drink. It can also be a form of dancing, playing music, like building interpersonal relationship. Adebia a healthcare practitioner and as a healthcare personnel provider, edin ho shame no. Patient no wa hotoso. Sa ade we say one doctor na nurse nya relationship a ma ne de ne ho shame nti ya na ya hwesa side no. Dan say ye impose. So rigid. Bejuado the aduane say be register be or get used to it
you could see the emotions, you could see the realities, the lived experiences coming to bear, the things we've seen in literature coming to bear, people expressing them, and these are the things we are looking for. And of course, people finding a safe space to also share their stories and be able to seek further support from people who are here. And what I'm very happy about is that this doesn't end here, but we are going ahead, we are creating a network, we are going ahead to ensure that we support each other, amplify our voices, and ensure that policymakers are doing their bit, healthcare professionals are doing their bit, family members are doing their bit, patients are doing their bit, and everybody is doing their bit. Dietary self-care adherence among type 2 diabetes patients living in Ghana is actually findings from my PhD studies or thesis, and it tells you that PhD or the studies we've done do not actually end there, but we want to move it from the shelf to ensure that it becomes an implementable study, and the evidence we find are implemented and they will have impact on the lives of many people with this condition in the country and at this point in the region, Ashanti region. So it's been a great time for me personally. I'm overwhelmed with emotions, but of course pleasantly surprised, and I hope that as we have all agreed as participants, we will not end here, but we will take it forward and ensure that everybody plays their part. Non-communicable diseases are real, dementia is real, diabetes is real. It is closer to all of us than we think, and we all need to put our hands on the wheel and work at it.
We'll have some citations to present to some dignitaries who help the research to come into fusion.
They say knowledge is power. And if you have it now, it means you've been empowered. It's also free hand, faculty anamo, Emma Obushia for Emma Afefo. And once again, I want to thank you very much for the opportunity, and I'm glad I had the opportunity to be part of this wonderful job. So congratulations and thank you very much for your attention.
So I want to thank the University of Huddersfield where I work for their great support, and of course I also received the staff fee waiver to do my PhD, and they had given me the little funding to do the dissemination together with the dementia one. So I thank the University of Huddersfield, specifically the School of Human and Health Sciences. I want to thank my supervisors for my PhD, who also doubles as my head of department, Professor Warren Gillibrand. I also thank Jill Warren, who is my other supervisor, and of course Dr. Caroline Barker, who used to be one of my supervisors. I also thank all my bosses who've supported me in diverse ways. Professor Philip Brown, who obviously is our lead strategically when it comes to research, innovation, knowledge exchange, and who administers this funding. I thank the university leadership from the Vice Chancellor all the way to Provice and Dean and all other colleagues I work with, my line manager, everyone in fact, and the students I teach as well. Without them, I'm not sure that I'll have the environment to be able to carry out this research. So I thank everyone, family, friends, and everybody who've put their hands to this project and ensure that it comes to pass. Specifically for those who have helped execute this project, I want to thank Professor Veronica Millicent Jomeku. I want to thank the leadership of KNUS, including the provost of the College of Health Science, Professor Christian Ejare. I want to thank the research assistant on this project, Joshua Ochre, Dorothy Wilson, Abigail Doso. I want to thank all of them for working extremely hard and all the healthcare facilities. I can't mention all the names, but they've been phenomenal. They've been very receptive and been supportive. Even at the last minute, they were able to push to ensure that we had people even beyond what we expected. So I thank everybody who has been involved, and many blessings.